Good morning, Ghada, and welcome to Climb. Thank you for joining us today.
Hi, good morning. I'm so excited.
Great. Well, let's just get started. This is such a great topic. So, tell us a little bit about your pharmacy's history and how you came to set vaccine efforts, how you set them apart from other pharmacies and what made you choose to do that in your pharmacy.
Yeah, my name is Ghada Abukuwaik, and I'm the head pharmacist at CureMed Pharmacy in New Jersey. And we are the facilitator for the New Jersey chapter, the CPSN, the Clinical Enhanced Services at the New Jersey. At CureMed Pharmacy, we have different wellness services for our community. The full pack, the rapid pack, the compliance package for our patients, the compounding, the diabetic education, the specialty medication, and of course, the essential vaccination and immunization services for the community. We highly believe that vaccinations and immunization is essential in every pharmacy. And we know that there are diseases that they are highly contagious and life-threatening, like tetanus, the whooping cough, the pneumococcal, the polio, the tuberculosis. And we highly believe that when a person is vaccinated, that's mean they are fully immunized, that will not only protect themselves and protect their family, but it's going to help to spread the to prevent the spread of the disease to the friends, to the beloved ones, and to the whole community. So we started when we established CureMed Pharmacy in 2015. The immunization was one of the pillars at the pharmacy.
Okay, so with that said, there are a lot of pharmacies that do vaccination programs. What do you feel differentiates your approach and your philosophy, from what the standard pharmacy is doing?
I believe that all my colleagues are doing amazing in that part. And I believe all of us, we saw what pharmacists did in pandemic and how they were able to spread the COVID vaccine and were able to help the communities in pandemic time. At CureMed Pharmacy, we have 4 different approaches in the vaccine clinics and in immunization. Protocol number 1, we ensure the availability of the vaccines at the pharmacy by working with our suppliers to secure those vaccines all the time at the pharmacy. That's really important for our doctors and our patients. Number 2, the number 2 protocol, the precise temperature control for the CDC compliant to keep our vaccines protected and viable. We use one of the companies, high-end companies, sensors. We use the OneView that we get the continuous monitoring system, which we have integrated software platform that our pharmacist will get the triggers instantly if anything happened to the temperature for our fridge or the freezers. So in this way, we ensure that we are maintaining the quality and the effectiveness of the vaccines. Number 3, we secure the transportation of our vaccines whenever we go to the centers, whenever we do the vaccines clinic, we ensure the transportation, the secure transportation of the vaccines. And number 4, which is very essential, keeping the network and communications with the city advocacy groups, the city councilors, the public organizations and agencies, the county commissioners, the schools, the clinics, adult home centers. We keep this kind of communication. Sometimes nowadays for the flu, we make sure to go to check with our schools, with the community centers that to ensure the flu vaccines is available. So depends on the time. In the pandemic, we make sure to, to spread the vaccines in different community centers. So the networking and communication with the city is really essential for all the pharmacists to do that.
So that's, you mentioned, and of course, independent pharmacy played a huge role in getting the COVID vaccine out there to the general public across the United States. Have you been able to get new customers, new prescription customers as a result of your vaccine program?
That's very essential. Yeah, thank you. Great question. The first thing, it was the trust that we build up with our communities, that we truly care about their health, and we spread the advocacy and the knowledge about the vaccines. And of course, it was one of the most proactive time in the pharmacy, I believe, board, that the patients believe in what we are doing to help them for their wellness. And the number of the patients increased at our pharmacy. And that's right, yes.
And I think that's something that it's this credibility and trust piece that a lot of independent pharmacies haven't had the opportunity even to build, because there's this general belief for a lot of people out in communities that, the chains are cheaper, it's easier access, all of these things that are typically wrong, are these assumptions that are wrong, and they don't even come into your pharmacy. So this is vaccines to me, and from what I'm, talking to other pharmacy owners, is an opportunity to get people in the door and then create that level of trust. So what did prompt you to get into this? Is that part of what was your prompting to really focus in the vaccine market?
The belief of the vaccines, as you mentioned, the belief that there are 6 disease killers: the measles, the diphtheria, the tetanus, the tuberculosis, that we are able to secure our communities from those kind of, and save their lives. So the vaccines in general, I believe it's a pillar for each pharmacy. And we believe in that. Of course, to add more patients is very essential and important for us.
Sure.
But the belief that the wellness, a pharmacy is a healthcare center. And if we are not providing one of the pillars to get well, then I believe there is something missing. So the vaccines, same as the medications, it has to be in a pharmacy, number one, for the safety of the community. And number two, you mentioned you're going to add more patients. There are so many things to add patients through the vaccines services and the vaccines clinic. Number one is the trust. People trust that those pharmacists care about their health. So they're going to come to you for more consultation about their diseases or different kind of things that they are facing. Number two, the proper services that you have at the pharmacy. When they come to ask about this vaccines related questions, you may able to mention to promote your compounding services. You would promote your compliance package service. You would mention about the different vitamins that they are available for different disease deficiencies. So there are so many different services that you would promote to your patients, the new patients that they're going to come just because you have the vaccines. We get so many calls from different patients through the state that we are not able to find the shingles in CVS and in chain pharmacies. And it's available at our pharmacy. So they come to us and they see our services, they see the great customer service, the independent community services from our team. So, and it's the mouth, they're going to start to talk about what you are doing. So it begins about the care and about the health and the wellness. And then it's going to go to the different things as adding new patients, let them know about the service, sell some items that you have in your front end, the OTC section. Even when they get the vaccines, sometimes they need to get the painkillers and other medications associated with the vaccines. So it's a great revenue for the pharmacy when you have it at at your place, at your store.
And that's what I was thinking. I mean, I've seen the commitment from the independent pharmacy world. I've been around it my whole life, as many of our listeners know, because my family had multiple pharmacies. And what I see vaccines and really all of the different clinical services as an opportunity to get somebody in the door to learn how much the average independent pharmacy owner and pharmacy staff members really care about their communities and want to help the communities become healthier. And so that's where I think when I think about chains, so there's this misconception out there that they're always cheaper, and that's just not true. And so people don't come to the independent pharmacy, they just keep driving by it. And this, to me, is another opportunity to get them to come in and find out about the trust that you just talked about.
I agree. And actually, many patients, when they call to check about the prices, of course, there are two parts about that: the cash patient and the insurances. The insurances, it will never change. It's going to be the same, the PBM. And we're going to talk about this if we're going to have time later on. About the cash patient, whenever they call a pharmacy, the community pharmacies, and they check the prices all the time. The prices at the independent community pharmacies are way different than the chain pharmacies. And honestly, most of the time, they are more affordable. I'm not going to say cheaper, because what we do is amazing and more, I'm not going to say better, but the care that we give the patients is way different than the chain. So it's more affordable, and it's available in the independent community pharmacies in different price than the chain. And they will be surprised each time whenever they call. They will be surprised about the prices.
And I know that for a fact as well. And I think that's why I always bring this up in conversations. And my friends who don't know this, they're always shocked to find it out. I said, just give it a try. Because it's not only is it less expensive in most cases, but just as you said, the quality of care, the level of care is significantly different and significantly better in most cases. So, as you were doing this, what are some of the roadblocks that you've encountered along the way, or do you still encounter some of them?
There are a few of the roadblocks. We have to be transparent about that, and maybe those kind of roadblocks will be kind of the challenges to other community pharmacists to have the vaccination or immunization services at their pharmacy. I'm going to leave the reimbursement at the end. I'm just going to mention first the let me say, the spreading the knowledge about the importance to get vaccinated. It's something that the team has to work hard to spread this kind of knowledge. There are so many rumors and inaccurate information, or sometimes maybe accurate information, but it's twisted to be used out of context. And you remember in COVID time about the vaccines of COVID, the boosters of it. The communications with the caregiver to let them understand the importance of the vaccine for their family members. That's also one of the road block. To show up on the vaccine's appointment day. That's also one of the things. Many times we have to go to the patient's home or to the daycare center, and this kind of transportation is one of the challenges as well. Encouraging the workers in different companies, even sometimes in the healthcare facilities, about the importance to get vaccinated, as simple as the flu vaccine. Many of our colleagues, they have this kind of a challenge to get the flu vaccines, and they have different kind of inaccurate information about that. Of course, the low reimbursement of the PBM. They don't encounter the traveling times for the pharmacist when they go to do the vaccines clinic. They don't encounter the new hiring that we have to have for the licensed and professional pharmacists, or in the COVID time, the licensed technicians to do the vaccines. The materials that we have to use, the gloves, the band-aid, the cotton, the alcohol swabs, the needle, the syringes, we use all that from the pharmacy to provide the vaccines for the patient, and we don't get reimbursed for that. The brochures, the stationary materials that we have to give to the patients when they get the vaccinated, per the CDC. The mixing time and the preparation time for the pharmacist when they do the live vaccines. And this is their time from their other work. How to secure the temperatures for the vaccines, and how much you have to pay for the sensors, the good, the high-end sensors, to make sure that your vaccine is viable and as we mentioned, and is maintained to have the right effectiveness. The paperwork that we have to fill at the documentation for the CDC, the protocols and the procedures that has to be in place in the pharmacies, the knowledge of the pharmacist about the patients allergic to some vaccines and the antidote, and how they have to provide, the antidote for the patient if any allergic happens to them. So there are so many things that we have to take in considerations when we would like to do the vaccines, or when we would like to have the proper vaccination services at the pharmacy. It's not just very simple to give the flu vaccine or any kind of vaccines. It requires a lot of standards and protocols and procedures and infrastructure in the pharmacy. And we would really love to see the fair reimbursement from the PBM to all what our colleagues are doing to ensure the wellness and for the communities, and the safety for the communities through the vaccines.
That sounds like a lot of roadblocks, but you obviously and others are doing it, and so you find the roadblocks are worth it, and that's what I have to take from this. You're doing it, so I don't like to scare anybody who's not doing it away, but what can you say with the roadblocks? What can you say to encourage pharmacies that are considering this but haven't pulled the trigger yet?
Okay, I'm just mentioning the protocols and procedures. Okay, those kind of, I'm going to say, challenges that we have to face in general as a community pharmacy. It's not only about the vaccines. I highly recommend vaccines, services in all the pharmacies. Those things, I'm just mentioning them to, just to, let me say, to spread awareness and advocacy. The vaccination is very simple when you believe in it. Yes, you have to encounter the same as the consultation for the pharmacist for our patients. They don't get reimbursement, but there are so many things in when we do the consultation for our patients. So we highly recommend the vaccine services, but those kind of things that you would like to let our colleagues and patients understand how we really care about their health and what we are doing behind the scenes to make sure that they are getting the right, safe, and effective vaccines. But let me mention how we're going to make this kind of challenges very easy to overcome. What we do, we have different protocols at the pharmacy. We have, I believe, 3 or 4 protocols to ensure the vaccines for all the community. Our pharmacists, during their sync calls, they do the sync call every month, and they do the MTM. Whenever they call their patient and they see the age of the patient is eligible, let me say for the shingles, over 50 years old, right away, they mention that you are eligible for the shingles, or let me say for the pneumococcal if they are, over 65. And they let them know that, we would like to make sure that you are safe and you're not going to get this kind of a disease. And after getting all the consultation with their maintenance medication, the pharmacist will let them know that, let us know, would you like to come to the pharmacy? We can provide it for you at the pharmacy, or you would like us to come to your home, per your convenience to make this happening. And actually, because of the trust, many patients, they would love to have that. And this is the click. With this happening, first of all, you make sure that the patient is getting, safe and more wellness with this vaccine. And you can promote, as we mentioned, the vitamins and other things. So this is something great for my colleagues. Um, the second thing, we have through our POS system, some triggers that whenever a patient come to pick up some medications, the clerk or the customer service, they will have a trigger that the patient is eligible for this, let me say, flu vaccine, or usually shingles or pneumococcal, depends on the age. If they are new and they still, didn't get the full training, they can ask the senior technician or a pharmacist. And if they've been, for a long time, been trained with us, then they will mention to the patient that you are eligible for this vaccine. Per your convenient, you can just, have few minutes at our pharmacy. We're going to prepare that for you. It will not take a long time, but it's going to save you and prevent you from different diseases. And of course, that also, we have many patients that because of these triggers in the POS system, they were able to get vaccinated and prevent them from their diseases. We have a monthly clinical calls through the senior technician that they will call the patients that with certain age that they are eligible for those kind of vaccines. And of course, it's amazing when a patient feel how the pharmacist or the technician, senior technician will call him to check on their health and let them know that, okay, now you are 50 years old and shingles disease is this and this, and it's only 2 doses, and they educate them about that. And many of them, they will be so happy to come to get the vaccine. And of course, some of them, we have to go to give it to them. But it just, they care about, how they feel that this call only because of you. We care about you, and it's important for you to get this kind of vaccine. So this is kind of monthly call that we try to do on monthly basis for our patients. And we send messages or campaigns nowadays, the flu shot. And we started, I believe, in September, that we send the campaigns for in general, the population, our patients, that it's a flu season, to stay safe for you, for your family, to protect your community from the flu. Please, make sure to get the flu vaccine. And of course, nowadays is the COVID boosters. So if you would like, you can get both. And because of the campaign, also the campaigns, we get so many referral and transfer and from the patients. Of course, we do the clinics, the vaccines, the clinic, but all these kind of things, this is because you mentioned about the challenges, those kind of protocols that we use at the pharmacy, we ensure to make vaccines simple, easy, I'm going to say fun, because, our team, whenever the patient going to say, yes, of course, I would love to have it, they will feel that they did something great for this patient life. And it doesn't make it a big challenge. Yes, you have to know how to do the billing. You have to have all the procedures available. But as a pharmacist, this is, I believe, something very simple for them to do it. And for their community, they will feel the love and they will feel the positive impact of their practice on their communities.
Yeah, those are all such great points. And you mentioned multiple times education and educating the patient. And most people want to get well, want to be healthy. And education becomes such an important point. You also mentioned you're doing med synchronization, and I've heard this many times that this is a good opportunity. Med synchronization, you get them on the phone. This is a good opportunity to educate them on other things. So, you use med synchronization? Is that one of your areas that you take the opportunity then to talk about? You're eligible for this vaccine and other things you're doing?
MedSync is a fabulous service that any pharmacies using the MedSync, they get so many great results from that. You speak with your patients, you communicate with them and you know, in a family, let me say, in a very nice way, checking on their health, checking what kind of side effects happening from whatever medication they are taking, promoting what you need, if you have different kind of new services. And one of the, I believe a must is mentioning the vaccines. Vaccines is a medication. Please just say it, and this is what we see it. Medicines and vaccines, they combine, they are kind of the same to treat disease. Vaccines treat very critical, as we mentioned, life-threatening disease. So if we are not going to educate our patients about that during the call, that call is for the patient. We care about the patient to check on their maintenance, medication, on their health, and to let them know if there is any important supplement that they need for the maintenance medication that they are using. And of course, to mention the vaccines, which is part of the medicines. So it's a must for each call, and it generates a lot of opportunities for the vaccines. Yes, MidSync.
So changing gear just a little bit, you've mentioned, and I want to kind of just highlight more. So a lot of pharmacies typically the patient comes in to get a vaccination, but you're doing more than that. So in listening to you, you're not just waiting for them to come in and sign up to get the vaccination. You're actually proactively doing things. So tell us a little bit more about that program.
When you open, when you open the independent community pharmacy, is not the same as the chain. So chain, people will just come to you because it's chain pharmacy. In independent pharmacy, uh, we have proactively to go to the community and to do our proactive part through either the phone calls or visiting them in their places or going to the community centers and promoting and letting the people know about what we are doing. So if we are just staying, behind the bench, counting the polls, we are not going to be able to get anything. So we cannot wait. A patient, of course, they are welcome. If we get the call from a patient, requesting a vaccine in new patients, they are more than welcome. And usually, 90%, this patient going to be with us later on because of the services that they're going to see from the team. But in general, we will not wait the patient only to call us. Of course, word of mouth, we have patients calling us, but as a pharmacist, community pharmacy, we pharmacists go and proactively, do our other things to get the patients in the pharmacy. We mentioned several things and networking, communication, being in the community, letting people know how we care about them, being in different setting in the community. Either you can say the workshop, the clinics, the schools, the churches, the city centers, the many different community centers that we have to communicate with them to be able to spread this kind of fullness. But 100% proactively going, out to our community is a must. Yeah, is essential.
Yeah. And, I see that, and it's interesting. When COVID happened, I was away from being able to go to trade shows and interact with our customers, and so I spent a good portion of 2022 flying to around the United States, seeing customers, going to trade shows, interacting, going to pharmacies, and it's really heartening to see the successes of the pharmacies that are innovating, that are listening to people like you share your experiences and grow their businesses by changing. And I think that's, when we started Climb over 2 years ago, which I don't know if you know, it stands for Care, Lead, Innovate, Motivate, and Balance. And when we started this program, it was to share this kind of the experiences of peers like yourself with other pharmacy owners to really be able to build their business, because the day of just filling scripts, putting that and making a lot of money, those days are gone. And so it's exciting to talk with people like yourself and share that wealth. And that's just part of what we have to do too. I tell business owners all the time when I listen to them complain about how hard it is, and it is in your business, and the PBMs are definitely a problem. But business is hard. We've been doing this here at RMS for 24 years, and it's changed dramatically, and how we have to do business has changed dramatically. And innovating and doing things like Climb are an important part of that. And so to all of you pharmacy owners out there listening to this, you have to change. And doing things like Ghada and her team, I think, are so important. That's why we bring this, this show out to everybody. Now, I just made a speech. I have another question, though.
Thank you. I really appreciate what you are saying. And actually, I listen to Climb all the time. And it's really amazing, what you are giving to us and what you are sharing with us. And truly, what you are saying is 100% I agree about. The wealth is not about the money. The wealth is, especially, I'm going to say in COVID time, how proactively all the pharmacists and pharmacists, when we went to different community places, the love of the people, the feeling, the stories that we hear, whenever we did, the COVID vaccine or the booster of the vaccine, just, you feel we are a human being, we are part of the community, and being able to be part of that for the pandemic and to help people, that is the wealth. Just to have the positive impact and to have this smile on a face, that is the wealth. Yes, of course, we care about the other part, because we cannot survive if we're not going to be able to keep our stores open. But the wealth is the happiness, is the love, is the caring, is giving. And of course, we have to take care of the other part as well. But you're 100% right, is the feeling, the love, and the caring about the community. That was the big impact.
Yeah, and it does feel great when you see a smile on somebody's face, because what you've done for them is help them. And I feel the same, when I'm doing work here at RMS, when I see a customer that's thrilled with the things we're teaching and the things that they're learning and the things they're able to do to build their business, there's no better feeling than that to me. So I do have another question, though. So we talked about MedSync and how it can be utilized. Are there additional programs, though, that pair well with not just, I guess, with the vaccine-centric approach, but really with the other things that you're doing, the other clinical service you're doing?
It's the patient is the center of our care. So yeah, Sync service that we do the calls, and we mentioned about the vaccine, the compliance package, which is, people know about the pill pack. Whenever we also do the compliance package service, it's opportunity to tell the patient about, about the vaccine. The compounding, people come for the compounding and they don't have any kind of maintenance medication or a sync kind of calls, but it's also a service that you would be able to, to have opportunity to mention about the vaccine. Whenever the patient is your center care, then all what you are doing, all the clinical services that you are doing is an opportunity to mention about the vaccine. Whenever we do the specialty and taking care of the specialty medication with the doctors and with the patient through the hub, you will mention to the doctors about the vaccine. If you don't have these vaccines available, or if you would like to send your patients to us, we have all the vaccines available. It's also opportunity through the specialty. In general, a pharmacy services, pharmacy nowadays, you mentioned it earlier, we are not just sitting, in the back of the bench and counting the pills. Most of the pharmacies right now, they are very proactive. We are not just filling up prescriptions and medication, counting pills. We are doing the enhanced clinical through the MTM, the medication therapy management. That is also a great opportunity to mention the vaccines. So any kind of service as a pharmacist, you care about the patient. Patient is your central, focus. You're going to mention the vaccine because it's a kind of a medicine. It's a part of, a treatment of a life-threatening disease. So it is something that we have to mention it for our safety of our patients.
Well, I'm done with questions. I would love, when I'm back out in New Jersey in the new year, I would love to come by and see your pharmacy and meet your staff and watch what you do. So it would be great and I will make that happen. I greatly, go ahead.
We would love to have you. You are more than welcome. It's going to be amazing and fabulous to have you at our pharmacy. And we are, waiting the new year, and happy holidays, of course, to everyone, to have you and to see you at our pharmacy.
Well, thank you again. Do you have any last words of wisdom, or are we good?
I just, I just would like to emphasize that, being a pharmacist, loving what we are doing as a pharmacist, if we feel that there is a closed door, make sure that there is hundreds of doors going to open. So if you feel that the immunization or the vaccine is a kind of a challenge, if you feel that, please call me. Give them, we can share my email and my phone number, because it's never a challenge when you see the results of what you are doing and how you are saving a life. It will never be a challenge. And make sure that many different great door gonna open for you. So and if there is any blocks, those blocks, they will never block us to do great things for our community. Those blocks for us to step on them to help our community even more.
That's terrific. Thank you so much for joining us, Ghada. I really appreciate it. Happy holidays. Happy New Year in the coming New Year. And I look forward to seeing you in the New Year.
Thank you, Brad. Happy New Year for you and happy holidays. And I have to mention that Climb is one of the marvelous services that you are doing for the pharmacists, for the community. I really appreciate all what you are doing in Climb. Thank you so much.
Well, thank you for those kind words.